Hi, I'm Anika Gianforti and I work for Cornell Cooperative Extension. Our team at Cornell is monitoring the coronavirus situation closely, and we are developing guidelines for the food industry. We would like to share some information about the coronavirus. Coronavirus disease, or COVID-19, is a respiratory illness that can spread from person to person. The main way COVID-19 is spread is through respiratory droplets. If an infected person sneezes or coughs, individuals in close contact could contract the virus. Though the virus could also be spread by touching frequently touched surfaces, the key ways to avoid contracting the virus are through social distancing and frequent hand washing. The virus that causes COVID-19 is different from foodborne viruses. There is no evidence that the virus is transmitted through food. COVID-19 is an enveloped virus. Enveloped viruses are very easily killed. Even if one were to ingest the virus that causes COVID-19, the stomach acid would inactivate the virus. The primary concern in the workplace is to protect the workforce from becoming ill. Please notify your supervisor if you experience any of the following symptoms: a fever of 100.4 degrees or more, chills, cough, shortness of breath, chest pain, out of the ordinary tiredness, bluish lips or face, muscle pain, runny nose or nasal congestion, sore throat, a loss of the sense of smell or taste, or gastrointestinal problems. It is possible that you could have the virus but show no symptoms. This is why it is critical to maintain social distancing and remember to wash your hands frequently, especially before touching your face, eating, and wearing face coverings. People can spread the virus before they know they are sick. It is important to stay away from others when possible, even if you or they have no symptoms. Social distancing should be maintained at work, and you should limit close contact with others outside of your household. Social distancing is especially important for people who are at higher risk for severe illness from COVID-19. Remember to stay at least 6 feet or about 2 arms lengths away from other people. Do not gather in groups, and stay out of crowded places and avoid mass gatherings. In addition to everyday steps to prevent COVID-19, keeping space between you and others is one of the best tools we have to avoid being exposed to the virus and slow its spread locally and across the country and world. Wash your hands often with soap and water for at least 20 seconds, especially before putting on gloves, after changing work areas, or after blowing your nose, coughing, or sneezing. Avoid touching your eyes, nose, and mouth with unwashed hands. The virus can enter the body through the eyes, nose, and mouth. To limit the risk of contracting the virus, it is important that you do not touch your face with unwashed hands or dirty gloves. This is why we focus on cleaning and disinfecting frequently touched surfaces and hand washing. Routinely clean and disinfect frequently touched surfaces such as doorknobs, control panels, and commonly used tools. Remember, you could spread COVID-19 to others even if you do not feel sick. Everyone should wear a cloth face cover when they have to go out in public. The cloth face cover is meant to protect other people in case you are infected. Continue to keep about 6 feet between yourself and others. The cloth face cover is not a substitute for social distancing. As we learn more about the coronavirus, your employer may implement screening policies to protect employees and prevent the spread. These could include practices like symptom screening and temperature checks. If you have any symptoms, stay home. If you have been in close contact with someone who has tested positive for COVID-19, inform your company's management. By following these CDC guidelines, we can minimize the spread of coronavirus throughout the workplace and the community. If you have questions, please feel free to visit our website at instituteforfoodsafety.cornell.edu.